Alright, we are going to talk about coronary circulation in this video. So coronary refers to the heart, circulation is blood flow. So coronary circulation is getting blood actually to the heart muscle itself, so getting blood to all of those cardiac muscle cells. We're going to learn the names of some of the main coronary arteries and veins in the lab, so I'm not going to go into detail about those here, but we do want to talk a little bit about this coronary circulation. Because it's really important. We still need that blood flow to those cells, and we are not getting blood like absorbed through the wall of the heart at all and going to those cells. They are actually going to have arteries and veins feeding them just like any other area of the body, and so you can see some of these vessels branch off of that aorta to take blood out to the actual cells of the heart, and then they will tie back in here to the inferior vena cava on the posterior side of the heart. Okay, so the coronary arteries are going to take oxygenated fresh blood from the heart out of the aorta and send it to the actual cells of the heart, and then the veins are going to collect blood, deoxygenated blood from those cells, and deliver them back into the actual heart itself to go through circulation, pick up more oxygen, all that kind of stuff. Okay. And so we have a lot of different branches of these different vessels here, and we'll see that happen a lot with blood vessels when we actually cover them in lab, where a vessel can have different names depending on where in the body it's found. The name can kind of change, just like a road sometimes changes names depending on where you are within the city or county or anything like that. Right. And so we've got all these different branches. They will go into capillaries, feed the heart, and then take blood back to get some fresh blood. So one really important thing I want to talk about here is atherosclerosis. That is a blockage of coronary arteries. So this is when we have a big plaque or fat buildup in one of the coronary arteries, or sometimes multiple coronary arteries, and this is going to reduce blood flow getting to those vessels after that blockage. And so here we see the circumflex artery. This is a really important artery in the heart, and so we're having this blockage of the left coronary artery up here, and we can see that that is really narrowed down. This darkness indicates blood flow, and so blood is flowing through here in very small quantities. We are getting blood out here to the other vessels, but it's having a really hard time getting through there, and this blockage can be either partial, so we can just kind of slow down blood flow, or we can block it completely and then no blood will get out to this area of the heart, which is going to lead to some major issues. Okay, so this atherosclerosis is that accumulation of plaque, that fatty tissue, and then the arteries are going to get really hard, and so they're not going to be able to stretch as blood pressure increases and stuff like that, and that is also really, really dangerous. So when we restrict this blood flow, and any restricted blood flow to tissues is called ischemia, and this is going to lead to hypoxic cells, which is low oxygen. So this is really not a good situation to be in. So individuals with coronary artery disease, which is all of these blockages, can sometimes have pain radiating out of the chest, which is called angina. Some people are going to be completely asymptomatic, and if this is left untreated, it will lead to something called a myocardial infarction, which is the medical term for a heart attack. Right? This disease is going to be very, very slow progressing. Some people are going to have a family history and make them more likely to develop this sooner in life than other people. And so it's really important to know as much as you can about your family history. That's not always possible for various reasons, but try to be on top of that as much as possible. This can be fixed a couple of main different ways. One is an angioplasty. We talked about this a little bit earlier, one or two videos ago. So they'll actually insert a little balloon into this vessel and then blow up the balloon, which is going to widen that artery and kind of push all of that out, and then basically open up that vessel. Sometimes they'll use a stent. This is usually going to be a special type of mesh that is going to sometimes be pushed out by that balloon and stays in place to keep that vessel open. And that can also help reinforce some of the weak and damaged walls. Bypass surgeries are another way of treating this condition. This is going to take a section of a vessel somewhere else in the body, and that it's not as important. That area of the body is going to have other sources of blood flow to it. We have a lot of redundancy in other areas of the body. We'll see that in lab. And they basically cut out that portion of the vessel, and then they are going to cut off blood flow to these blocked vessels and use the other one and graft it on, and kind of just bypass all of this. So it's like a detour for the blood flow to get around these blockages. And so this is a very effective procedure. But doesn't actually generally increase lifespan. It just can improve quality of life and decrease the risk of a myocardial infarction. So myocardial infarction, again, is the medical term for a heart attack, and this is going to result from that decreased blood flow and oxygen to a region of the heart, resulting in the death of the cardiac muscle cells in that area. So if we're not getting enough blood flow somewhere, then those cells are going to end up dying. All right, and so the heart muscle cells are not going to regenerate themselves, and so once that area dies, then those cells are dead permanently forever, and that can unfortunately increase the risk of having another one, so it's best to avoid having that heart attack to begin with. And then down the road, if you're not making lifestyle changes, then you'll definitely most likely have another one. And so because the myocardial infarction is is death of those cells, that's what's causing that pain and stuff like that. There are some differences between sexes that we've noticed, interestingly, and nobody's really sure why there's differences between the two biological sexes. The suspicion is that it has something to do with hormone levels, the testosterone versus estrogens and progesterone, but we're really not sure at this particular point in time. But pain from the chest, usually radiating down the left arm in people with a lot of testosterone, but not in people that are going to have higher levels of estrogens and progesterones. Common symptoms can be difficulty breathing, shortness of breath, an irregular heartbeat, so feeling like your heart's fluttering, some nausea and vomiting, a lot of sweating, excessive anxiety, sometimes referred to as a sense of impending doom, and then fainting. Not all of those symptoms are necessarily going to be present, and sometimes they overlap with other things, but it's always best to get that checked out if there's any concern. And then some myocardial infarctions can happen without any symptoms whatsoever. And so these are diagnosed based on looking at an ECG, and there will be alterations of some of those components, the ST and Q components usually, and so there are going to be different results from those ECGs, depending on what type of heart attack happened and how severe it was and stuff like that. There's also some blood tests that look for certain enzymes that are produced from this particular type of tissue death. And so there are some really good immediate treatments: supplemental oxygen, aspirin to help break up any clots, nitroglycerin to help that aspirin gets absorbed, and stuff like that. So myocardial infarctions themselves are not necessarily deadly. If they are, it's because they lead to something called cardiac arrest. And cardiac arrest is different. So that heart attack, again, is death of those muscle cells. And then cardiac arrest is when the electrical signaling of the heart stops. So myocardial infarction can lead to cardiac arrest, but they are different conditions. And we'll pick up in the next video, wrapping up the heart with development, and then we'll get into blood vessels.